Very good evening to everyone. We are here with yet another session, and today's session is very unique in two concept on the two perspective, which is first it would be question and answer, and to whom we are question and answering today. That is the person I wanted to introduce. He is a Dr. Kashi Viswanath. He is a student of MBBS. He is studying in the KMC Manglore, and right now he is serving his COVID duties to all over the people who is needing. So we heartily welcome you in this busy schedule of yours. You have given time to us and all the students who are listening to this talk. So thank you so much, Dr. Kashi, to come on our platform.
Thanks, Bhavit, for having me here for once again. So, so where shall we start with the whole COVID thing? So, as we all know, it was declared as pandemic in 2020. That COVID has become a serious issue, and nation has to take a call. So, why it has become very serious? That's the first question. So one thing is it's transmitted from human to human, and it has got a aerosol role also. So it's in that way it's super fast transferring virus from one person to another person, and it infects almost everyone. And initially we used to think that it only attacks the extremes of age, and it doesn't do anything in between some 20 to 30, 30 to 40, like 20 to 40 basically. But the thing is, uh, the mutated strain did affect many people in the 20 to 40 age group in a very severe manner. And I myself had evidenced a few deaths in ICU who are 22, who are in this age group. So, what exactly is going on inside the body? I wanted to tell you what exactly happens at molecular level when COVID infects you. So once the virus enters our body, so this COVID virus goes and attaches to and binds to ACE2 receptors, which are present in type 2 pulmonocytes. Okay, so these are the cells present in the lung. Uh, so once it attaches to the type 2 pneumocytes, and then it replicates inside and produces spike protein. So this spike protein is the basis for all the vaccination and their mechanism of actions. Okay, so I'll brief you about vaccination. How does it work? So one thing is either it could be inactivated virus can be injected, or the virus, the protein of the virus because of which the whole pathogenesis takes place, even that can be injected with reduced severity into our body, so that our body makes its own defense mechanism strong, and make it won't be naive anymore when the actual virus hits our body immune system. So this is how our body prepares itself for the upcoming infection, or upcoming how to encounter the whole infection. And then in this whole process, antibodies and memory cells forms a huge role. Antibodies are nothing but, just imagine a kingdom. Okay, so a kingdom, the kingdom is our body, and which is getting invaded by people from outside. That is nothing but the virus. Just imagine in that way. So now this kingdom has never encountered such people till now, till date. So as a mock drill, we are inducing a less potent uh, form of virus, which is inactivated, or the protein of the virus we are injecting into our body, so that our body makes a blueprint of defense, how to encounter this person and how to release the antibodies and so on. So in order to make you guys understand, I just gave it an analogy of the kingdom and thing. So this is how the immunity works and the vaccination uh, works. So right now, once the virus enters the body, so a person's immunity is depleted, just imagine. And then this virus goes and binds to ACE2 receptors. And this ACE2 receptor is present in type 2 pneumocytes. So now what happens? It synthesizes and replicates spike protein. Now the spike protein comes out and initiates a cascade of reactions. So we call this as cytokine storm, which is the basis behind the treatment of COVID. So once I tell this, every treatment methodology will make sense slowly, slowly. So now the cytokine storm is mainly because of interleukin 2, interleukin 6, and TNF alpha. So these are the uh, inflammatory cytokines which are released into our body when some when this COVID virus attacks our immunity. So these inflammatory cytokines, we give corticosteroids to suppress these inflammatory cytokines so that the cascade reaction doesn't go worse and infect multiple organs in the body. It's just like a wildfire. Like to how do like if you want to understand very well, it's just like a wildfire, and corticosteroids are like water which can suppress the wildfire. So this is how it works. So now these inflammatory cytokines, if they go to heart, they lead to myocarditis, inflammation of the cardiac muscle, and slowly it leads to myocardial infarction and sudden death, cardiac related death. And then if it goes to the kidney, it will lead to renal failure. If a person's kidney is already debilitated because of diabetes, okay, due to excess glucose levels, and if there is any proteinuria, so these are all already the kidney is experiencing some kind of turbulence in the function. And now, since it's not a normal kidney, when the infection just goes there and uh, initiates the reaction there, definitely it will lead to renal failure there. And then when it comes to the lung itself, it damages the endothelial barrier, because of which pulmonary edema, and slowly there could be you can see the ground glass appearance on CT. That's why we get a CECT done also. So HRCT done. So this is how it works. So this is a brief outline about mechanism of action of COVID virus, how exactly it goes into our body and binds to, and this is why it leads to multi-organ failure. So this is the cytokine storm part of it. And second thing is, it's very important. It's COVID itself is a procoagulant state. So what is procoagulant state now? So our blood texture gets altered because of this viral infection. So because of which we treat patients with a low molecular weight heparin in order to prevent excessive clotting of the blood anywhere in the system, because of which any organ failure can occur if it does not get the proper amount of blood. So that's how it is. So I guess you have got some questions.
Yeah, and this was a very kind brief. And if I talk, there is a situation nowadays. We heard a term, few terms. Like last
Yeah,
year,
yeah,
the terms was quarantine, COVID.
yeah,
This year, the terms are steroids. So my
yeah.
questions will be basically on that immunosuppressants, steroids. So these are the few terms. So I'll ask questions
Okay,
regarding these things. So please,
okay.
you get the answers regarding what we are looking forward. So my first
Yeah,
question.
I'll try my level best to address
Yeah,
everything. So yeah,
definitely.
please.
Yeah. So my first question is, steroids are supposed to take as the last treatment in the case of COVID-19.
Yeah.
So are steroids really required for all of the patients, or these steroids, whatever we are using, have side effects or not?
Okay. So the basic thing I would like to address here is steroids are not required for everyone. Okay. So in COVID, there are three categories of diseases. So mild, moderate, and severe. Okay. So now mild people does not really require any kind of drug intervention in their system. Mostly they get well on their own, and they just need to be quarantined in the home and then given proper support emotionally and physically with the nutrients supply. That's it. And coming to moderate and severe, these cannot be treated at home. These definitely need a hospital setting. And depending upon the clinical, the physicians correlate clinically how the patient is doing, how the patient saturation is, whether how many liters of oxygen is. So we measure a patient's ventilation in terms of how many liters of oxygen that person is having under nasal prongs or mask or whatever it is. So if it is like 2 liters to 4 liters of oxygen, if the patient is having via nasal prongs, that's normal, okay, when compared to 15 liters per minute, which is too much. Uh, So this is how it is. Only mild cases does not need anything, and moderate to severe depends upon how well the person is recovering, and how bad the lungs have got infected, because of which we take a HRCT scoring out of 25. I've explained in depth about it in the first lecture, if you have an idea. Like, the lungs are divided into 5 segments, and each segment is given a score of 5 to what extent it has got infected. So this is HRCT scoring, like CT severity basically, not the Corad score. It's a CT severity scoring. So depending upon these things, uh, we might need to use in moderate or severe patients. And the sad part is there is this false notion everywhere, because of inadequate education and lack of knowledge. The people have started using steroids on their own as an over the counter drugs. The reason why we develop resistance to certain drugs and antibiotics so soon is because of availability of over the counter everything. So in foreign, if you, until and unless you give a prescription with the date, if the date is not expired, then only you will be given the drugs. But here, you just need to say the drug name and you will get it over the counter mostly. So that's the reason why our we suffer from this phenomenon of drug resistance. And coming to steroid, no, not exactly everyone needs it. Only few people need it. And the sad part is the people who are in need can't get it because of the people who are not in need stocking up because they might want in future. I hope it explains.
And that is why our country is having so many problems. The management, if it fails also, the people should support in that way, that it should not imbalance the situation what it is happening right now.
Yeah, exactly. When you just go and ask a person without even prescription, then you'll definitely get the drug. All he is concerned about is whether he's making money or not there.
Yeah,
So the rules are also not stringent from the government side, that without prescription drugs shouldn't be given. And it's very, even though the rules are there, the way they are amended, established, is not a proper way.
that is why we need a proper education to deal with the people in this kind of pandemic or in future too. So
Yeah.
that is why my second question is related to that. See, nowadays steroids are used in multiple cases without or with prescription. But
Okay.
with the cases of steroids, with the use of steroids, the cases are seen as of hyper response of the lungs. Maybe it is because of steroids or due to other antibiotics undergoing, but there are few cases of hyper response post COVID pneumonitis. So why and
Mm.
what leads into these conditions?
So, as I told you about cytokine storm, that itself is a hyper responsive reaction. It's more than hyper responsive. It's like a more of a wildfire, which can actually destroy any vital organ which it can enter into. So, this coming to part of post COVID pneumonitis, uh, the only thing which you can do as of now is supportive oxygenation therapy. And second thing is intensive spirometry, or like, I'll tell you how it looks like. Like, the spirometry is basically is having like 3 chambers and with the 3 balls in it. The patient is supposed to raise all the 3 balls with inspiration. So that's how it works. And it actually drastically improved the lung function of many people. So that's how post-COVID pneumonitis can be treated with anti-inflammatory. Antibiotics are given only if there is any change in sputum color. Otherwise, they are not at all given. For now, this is a supportive therapy only. And in COVID, we don't have a definitive treatment. We have guidelines laid based upon the symptomatic treatment. The two major concerns of whole COVID thing is the prothrombotic state and cytokine storm. So accordingly, the medications are given.
Okay, so that is very true, and that is how a patient or doctor should go in a way to treat the patient.
Yeah, we have something called protocol. Depending upon which these protocols are laid by AIMS New Delhi. That's the body which laid down this protocol, and whole nation has to follow the same kind of protocol in order to achieve desired results. So
Mm.
if everyone has their own cocktail of medications or own protocols, then it shouldn't be like that.
And that is how a country is now becoming so somewhat less in the number of cases in this month, if we
Yeah,
nowadays.
and especially because of the hugest vaccination drive that has become a success. And I told you how does actually vaccination work.
Yeah.
And yeah, it's it's really good to see that there is a drop in case surge because of vaccination.
There was a time, 2 months before, in between that period of time, the remdesivir injection were used to treat coronavirus, and
Yeah,
there was a term called black market of this injection. And why
yeah,
the WHO is against to this injection right now? Like, this is not given through WHO rules or terms that we should give this injection to the patients who are suffering from coronavirus. So what?
yeah. So basically, this remdesivir is antiviral. It's not newly invented drug. It was always there. Remdesivir. It's just an antiviral drug, and we once this is only effective when it is given in first few days, like at least say first week, and it is given in the dose of 5 doses for 5 continuous days. And initially there was a slightest improvement in the patient's vitals and the patient's condition. So we used to recommend remdesivir, and now we got to know that the treatment, the only actual treatment which are working right now is corticosteroid therapy and low molecular heparin infusion. So these are the only two guaranteed things which are working till now. That's the reason why remdesivir is not there anymore, and like it's not like mandatory thing now. But still, as long as its availability is there, patients are being given that, like for 5 days of course, and once the 5 days are done, the course will be complete. If
Okay.
you remember, there is something called favipiravir, Fabiflu, those
Uh,
tablet sheet,
Still
which is
now
some
it is,
2,200.
yeah, and
Yeah,
still it is called of black market is affecting these two antibiotics, antiviral drugs and remdesivir injections.
yeah.
So
The thing is, people are very paranoid about this whole COVID scenario. They are thinking that people who will get COVID, they'll die, and then they're stocking up the oxygen cylinders, medications, whatnot, everything, all the possible facilities they can get. Uh, so that's the reason. The people who are in actual need, like moderate to severe patients, excuse me, so they are not getting the required support.
and in my two questions are there right now. That would be the last of this session, but that covers most of the things.
Yeah,
Today's media will focus of COVID in terms of anything, in terms of many things. There are two things, anything and many things. But
mm,
this COVID is suppressing immunity, and the
mm,
patient who is infected with COVID is having very suppressing immunity. Might not be due
mm,
to antibiotics, but due to the virus itself. And
mm,
the this wave, second wave, is affecting a younger generation, as you have said in your talk, in the starting of your talk. So how
yeah,
do we protect them and how do we guide them in after they are illiterate, but still they have the fear that it might affect us, it might kill us. So how do you guide and
yeah.
tell them?
So I was actually thinking about how we can spread true information. So when we go to the ground level of healthcare workers, there are ASHA workers and midwife. So these are the people who actually take care of the ground level of healthcare system. So if we can educate them properly in their own language, then they can go door to door in that particular street, and then they can educate the rest of the people. The sad part is this whole fake news is going faster than the actual news. Now we need, everyone needs some spice up in the news, so that then only we can think that yeah, it is there, otherwise it's not there. Just like recently some person X, I don't want to comment the name, he said that 1,000 doctors have expired after taking the second dose of vaccine, which is very false. And I think all these celebrities who are having really good influence on Instagram, WhatsApp, wherever it is, all the social media platforms. I think they should stop advising people regarding the medicines rather than start spreading awareness through some or the other kind of posts, which makes sense. And then educating the ground level workers, ASHA workers, and Anganwadi workers, they are, we might not think in that way, but if we can educate them properly with legit information properly, if there are any good classes for them, like what exactly is COVID, how does it act in, and if a person can explain them in their own understandable language, then you can actually see revolution in the information. And we believe in hear and say things, and then the oral publicity is the more than any other thing. So it's better to educate people in right way rather than, you know, with this fake. There is a lot of bullshit over in social media. Sorry for my words, but yeah, I couldn't contain myself. So it's very difficult for doctors or any other healthcare workers from any field to go and clean up all the mess created by the quacks.
Might be your words were appropriate in this period of time because it is happening a lot. Everyone
Yeah,
in the society is teaching. That is
yeah,
not their concern because every field is created to make their concern very precise or very
yeah.
precise. We say, if we take your part or you take our part, that is a
No
mess.
one can.
Yeah, that is a
Yeah,
mess. We, not we, but the people, the general people, like the giving some advices through WhatsApp media, through Instagram. Every student should take the part in awareness, not as a teaching or giving medication online through reels, through many things which is going on right now. We can say multiple sources are there for the same information.
mm,
And secondly, if we guide through our students, if our students guide everyone in a proper manner, we have a lot number of students in India, medical, Ayush. There are, if you count these two communities itself, we can handle all the people together because the number of students are there, that is too much. And these students are the only one future. We are the future of this country as in the healthcare system. If we
yeah.
do not,
So we have to be rightly educated with everything which is going on, and the people should also be equally enthusiastic to learn what exactly is going on. So then only we can focus on the development. Otherwise, it can't happen.
yeah. So there is a so much talk we had done with the steroids, with the immune system. We had a COVID vaccination. What would be
Yeah.
your concluding and parting thoughts, not to me, not to yourself or any community, but for the whole who watch this a 20-30 minute session?
Acha. So my request is for the people, it's always better to not get infected. Okay. So for that, or it's always better to not get infected. Or if you get infected, also it's always better to have a reduced severity of it rather than progressing it to. So our vaccinations for COVID are aimed at reducing the severity of the infection rather than, they cannot promise you about the infection can happen or not, but definitely they can reduce the severity for sure. So that's what efficacy of the vaccine deals with. The people who are affected, if they are supposed to get affected in a very bad way, like in a severe way, they can get moderate infection, and the otherwise like moderate to mild. And the people who are prone to get mild infection, they could get asymptomatic infection. So this is how vaccination works. First thing I would like to convey is, please do not go about all the blunders about vaccinations. So you can always go to MOHSW website, and there are FAQs column there regarding vaccinations. You can read that. That's properly curated and written by all the experts of it. So there is no misinformation. So if you see any misinformation or social media, or if you think that it's a misinformation, it's always better to stop sharing it. It could be regarding COVID or any other disease or anything. And that's how we break the cycle. That's the first thing. Get vaccinated and don't fall trap for the false information. And second thing is, just because you're vaccinated, it doesn't mean that you are free from COVID appropriate behavior. So please maintain social distancing, Please follow the protocols laid down by the government, whatever it is. uh, Mask appropriate, COVID appropriate behavior, mask hygiene. So these are all things. And finally, uh, many diseases, many ailments in the which we are having can always be reduced with a good immune system. Okay, so let's make it strong by inculcating healthy lifestyles, changes, and good dietary choices. So this is my conclusion.
Thank you so much. And I wanted to thank you first that you have given your time in this pandemic situation where you're working in the hospital as an intern and you are serving many peoples. And that is our duty to serve in this period of pandemic. And secondly, you have covered the 4 points: immunology, steroidal effects or corticosteroids or all kind of medications used in this COVID. Second, awareness, not in the false way, but you should fall trap in the good way in the social media. And I must say, everyone who is watching, he is really doing very well in social media with the term called the muscle mechanic, where you can go reach and understand the concept which is good and which is real, which is from the evidence base, just not from the reading Google. And it is evidence based approach in the Instagram, where you all the teenagers or all the age group people are coming up right now in the Instagram. So if you use his page, it would be very good for you to grow in a very good way in your life, in your future, for your health. So thank you, doctor, to come and share your views. And you can ask him anything, anytime. Just Instagram, you ping him. The muscle mechanic page is there. And hope we can connect every day, every time. I do like the sessions. So thank you so much to come on our OYG platform.
It's completely fine, Bhavat, and thanks for having me here. And it's my piece of thing which I can do for this society where there is a lot of fake information. I'm just doing my bit to clean up this thing. So let's see till what extent it goes. And thanks again for having me here. I really enjoyed the whole session, and it actually these questions actually provoke me to think in a different manner. But so after the last session, I was actually thinking how to reduce the misinformation, and I got this ASHA workers concept and uh, Anganwadi workers concept and into my mind. And yeah, so it's really good to speak once in a while, once in a week, and then talk about the whole situation and spread right information.
And that is how we can learn mutual learning, mutual understanding. That is very much
Yeah,
required in this period of time. So thank you, doctor. Have a nice day.
yeah.
Have a nice evening. Thank you.
Thank you.